online learning has led to loneliness for a lot of children, many of whom will be going back to in-person classes soon if they're not already there. A Buckeye Health Plan, we've got Laura Paynter with them. She's here to take a bigger look at the impact to those students as they go through this transition. Thanks for talking to us.
Good morning, Rebecca. Great to be here. And as a parent with 3 school-age children, I can attest that the struggle is real. And as you noted, the pandemic's caused major disruptions for Ohio families, particularly those with at-risk school-age children.
And Laura, what's such a startling statistic to me is that up to 30% of parents say their child is experiencing harm to their emotional or mental health because of things like social distancing and school closures, virtual learning.
Certainly, and it is alarming. And we know that mental health disorders are the most common diseases of childhood, and about 1 in 5 kids experience a mental health disorder in a given year. So children already coping with mental health conditions have been especially vulnerable to the changes due to the pandemic. And all children may experience mental health impacts from prolonged social distancing and virtual learning, but research shows that loneliness in kids, especially over extended periods, is linked with depression and anxiety.
So do you feel optimistic that these kids can get back on the right track with the help of their support system, i.e. the schools, their friends, and parents?
Absolutely. We know that lack of in-person social activities, canceled recreational activities, vacations, leaves kids feeling confused or uncertain or frustrated. And so they're looking for ways to help cope with their feelings. But schools have been effective in hiring counselors to help students cope with mental health challenges. In-person classes increases the sense of community and support for children through networks of friendships, teachers, and other support staff. And schools are also increasing social and emotional learning through dedicated curriculum that builds skills such as self-awareness, emotional regulation, flexible thinking, relationship building. I mean, these are essential skills to help give students the abilities to adapt during these uncertain times.
And Laura, you say that the schools are essential in improving food insecurity, something as basic as these kids not going hungry.
Absolutely. So for many students, the home environments offer challenges not only to their mental health, but also physical health and well-being. Parental stress from the pandemic, including loss of income, need for childcare and schooling responsibilities. What we've seen is an increase in substance use and mental health conditions, which puts kids at an increased risk for child abuse and neglect. We also know that about 1 in 5 Ohio families report food insecurities with not being able to have school provided breakfast and lunch. So there are huge nutritional gaps for families right now.
Well, it sounds like the picture's improving. There's light at the end of the tunnel. And for some of these students, it's imminent if they're not already back in school in person. Thank you so much.
Thank you.